the state of Georgia had need for more medical students, and the Medical College of Georgia was contemplating expansion of the medical school classes. And we thought, why not Rome? We have three major medical institutions here. Floyd Medical Center, which is a regional trauma center, Redmond Regional Medical Center, which is known for its cardiac care, and the Harbin Clinic, which is the largest privately owned hospital in the state of Georgia and one of the largest in the Southeast. What we've seen with the Medical College of Georgia here is in the Northwest Georgia Regional Campus is a cooperativeness between all the institutions I just offered.
Well, I think the whole community here rallied around this idea of bringing medical students to Rome. For Redmond, we were interested because I think the spirit of inquiry that comes with being involved in medical education is something that's very good for a hospital.
Having MCG students here really gives us the opportunity, as we're recruiting these individuals, to say, not only do we have a tertiary center, we also have the ability for you to be able to teach.
I think this is an absolutely ideal location for teaching. We have a robust medical community.
The beauty about this program is it's longitudinal in that you're consistently being exposed to pediatrics and all the other disciplines as well, all year long.
The students continue to get dribs and drabs all year long of pediatrics, neurology, surgery, OBGYN, family medicine, internal medicine. And so by rotating in and out of these things, you never lose the knowledge. You keep reinforcing the knowledge by every time you step back into that role.
Week by week, we'll be changing from one department to another. So one week we might be in family medicine, the next week we'll be in neurology, and then a couple weeks later we're in surgery. We follow patients long term. You know, I hear their concerns and their questions at each stage of the game.
I like that I'm doing something a little bit different every week, and I get to watch how one area really influences the other. That's really interesting for me. So I started on psychiatry, and now I see little pieces of psychiatry everywhere, and it really is, medicine is not pediatrics. You know, a kid has all the same organs that an adult has. They have behavioral issues.
Medical students are considered full team members and function as team members. They can start from day one, seeing patients, working up patients. They get a lot of clinical experience.
But the nice thing is they're one-on-one with me the entire time. There's no residents on the service, so they get to participate at the level of decision making to the level of operative intervention.
The amount of hands-on experience that I had and being able to see patients on my own and feeling more responsible for the work I was doing was probably one of the most memorable experiences I had.
The physicians and the faculty up here are so engaged in our education because of that one-on-one interaction in the clinics, but also because of the academic side, the lectures that we have here.
Well, for me personally, teaching is a part of practicing medicine. And when I'm seeing a patient and I see something very interesting, whether it's an interesting diagnosis or it's an interesting part of a physical examination, it helps to be able to show that to another person, whether it's another physician or a medical student.
Well, it's part of securing the future generation of both practitioners and hopefully future educators as well. Ultimately, I'm going to need a doctor, and I want to have good doctors that are going to come in place and take care of me someday.
You know, getting to work with patients in the continuity program really gives you a voice, and I hate to say it, but it makes you really useful. Just recently I had one of my OB patients call me because they had gotten tests about Down syndrome and they didn't know how to interpret it, and it just went right over their head in the doctor's office. So I sat there for 15 to 20 minutes on the phone with her and just we talked about it. And you know, I know that me being there meant so much to her, and I know her anxiety was significantly decreased just getting to talk with me about it.
It's amazing how patients really embrace having a student be their representative in the doctor's office. The students follow patients, and the patients are the best teachers. We do have wonderful faculty here, but the patients will teach you more if you just listen to them. And that's what our students get a chance to do.